Let's dive into urinary tract infections, or UTIs. They are, without a doubt, one of the most common bacterial infections out there, but they're also surrounded by a ton of myths and misunderstandings. So in this explainer, we're going to cut through the noise and get straight to the facts. What an uncomplicated UTI actually is, how it even starts, and what the modern science says about treating it. Let's get into it.
And if you're wondering just how relevant this is, take a look at this number. A staggering 40% of women will get a UTI at some point. And for about 1 in 10 of them, it's something they deal with every single year. So yeah, this isn't some rare, obscure condition. It's an incredibly common health issue that we all need to understand a lot better.
So, first things first, let's define what we're actually talking about. What makes a UTI uncomplicated, and why do they seem to target some people way more than others?
Now, that key term here is uncomplicated. And listen, that's not just medical jargon. It's a really critical distinction. It means we're talking about a standard bladder infection. The technical term is cystitis, happening in someone who's otherwise healthy. So no kidney stones, no catheters, no underlying immune problems that would make this a much more serious or complicated issue.
So, how does this whole bacterial invasion actually happen? Well, understanding the anatomy of the infection is really the first step toward figuring out how to prevent it.
All right, meet the main offender, E. coli. This bacterium usually lives harmlessly in our intestines, but it becomes a huge problem when it gets into the urinary tract. It's responsible for the vast majority of uncomplicated UTIs. It's basically a classic case of a microbe being in the wrong place at the wrong time.
So why are women so much more likely to get UTIs? Honestly, it just comes down to basic anatomy. The female urethra, that's the tube that carries urine out of the body, is much shorter than the male urethra. And that shorter distance, it's like a superhighway for bacteria like E. coli to travel from the outside right up into the bladder.
So let's actually trace that path of invasion. It's really a 3-step process. First, you get colonization, where bacteria from the gut set up shop near the urethra. Second, you have the ascent, where they travel up that shorter path into the bladder. And finally, invasion. They don't just float around in there. They have these little hooks they use to latch onto the bladder wall, and that's what triggers the inflammation we call cystitis.
But it's not a totally one-sided fight. Our bodies have a pretty sophisticated security system built right in. Urine itself is actually hostile to bacteria because it's acidic. The bladder is lined with a protective mucus. And the simple act of urinating is literally designed to physically flush out any invaders before they can get a foothold.
So, what happens if an infection does manage to take hold? How do you recognize it? Let's talk about the classic symptoms, and then how doctors figure out what's really going on.
So what are the body's alarm bells for a UTI? The classic signs are pretty hard to miss. First, there's dysuria. That's the medical term for that painful, burning feeling when you go. Then there's that constant nagging feeling that you have to go right now. That's urinary frequency and urgency. That often comes with pain in the lower belly and sometimes even hematuria, which is just visible blood in the urine.
Okay, so you've got these symptoms. You head to the doctor. How do they go from just a suspicion to a definite diagnosis?
Well, the first step is almost always a simple urine dipstick test, and doctors are looking for 2 key clues. The nitrate test is super reliable because bacteria like E. coli turn nitrates in your urine into nitrites. So if that's positive, it's a huge red flag. Then there's the test for leukocyte esterase, which basically detects your white blood cells, a sign your immune system is putting up a fight. Together, they give a quick and powerful clue. But the gold standard, the test that gives the final answer, is a urine culture. This is where a lab actually grows the bacteria from your urine sample. Now, why is this so important? Because it doesn't just confirm there's an infection, it identifies the exact bug causing the problem, and crucially, tells the doctor which antibiotics will actually work against it. And in today's world of growing antibiotic resistance, that's absolutely vital.
And that leads us right to the counterattack. Once a UTI is confirmed, what's the modern game plan for getting rid of it effectively?
So doctors have several go-to options. Nitrofurantoin is a real workhorse, usually taken for 5 to 7 days, and thankfully, resistance rates are still pretty low. For convenience, fosfomycin is a powerhouse. It's a single one-time dose. Then you have the classic 3-day course of sulfamethoxazole trimethoprim. But here's the big catch. Resistance to it is really high in a lot of places, making it less of a sure thing.
And this right here is the critical rule of thumb for doctors today. This quote really nails it. If local data shows that more than 20% of bacteria are resistant to a certain antibiotic, it just shouldn't be the first choice anymore. This is exactly why knowing those local resistance patterns, guided by those urine cultures, is so important.
Now, you might be wondering about other antibiotics you've probably heard of, like Cipro. Those belong to a class called fluoroquinolones, and while they were used all the time in the past, the guidelines now strongly recommend against using them for simple UTIs. That's because of both rising resistance and a better understanding of their potential side effects. They're now saved for more complicated infections.
Of course, the best way to deal with an infection is to not get one in the first place, right? So, let's wrap up with some real evidence-based strategies for building up your defenses. And these strategies are really all about simple mechanics and smart hygiene. Drinking more fluids literally helps flush the system. Urinating right after sex can help clear the urethra. The classic front-to-back rule is all about preventing the transfer of gut bacteria. And simple choices, like taking showers instead of baths and using gentle soaks, can minimize both irritation and bacterial exposure.
And what about all those supplements you see everywhere? Cranberry products and D-mannose are incredibly popular, and yeah, some studies suggest they might help. But the truth is, the overall scientific evidence is pretty mixed. As of right now, it's just not strong enough for major medical guidelines to formally recommend them as a surefire prevention strategy.
All of this brings us to a really powerful final thought. We know bacteria are constantly evolving, and we know our antibiotics are slowly becoming less effective. So as we look to the future, is it possible that mastering these simple prevention strategies will become our best and maybe our most important form of medicine in the fight against UTIs?